So, today we will talk about a disease that is very common among the people around the globe, and this disease is dementia. For the contents of this slideshow, we have the introduction, which is basically an overview on the disease. We have the symptoms, causes, and risk factors, functional foods that we can consume to help with dementia, omega-3 interaction with the disease, dosage, recommendations. So now we come to the one and only question that we have, which is what is dementia? Dementia is the name for a group of symptoms that commonly include problems with memory, thinking, problem solving, language, and perception. We can also say that Alzheimer's disease is the most common form of it, and basically the symptoms for dementia includes memory loss, confusion, and some problems with communication. And as we mentioned before, that dementia is very common. We can say that currently more than 55 million people worldwide have dementia. We can just describe dementia as an umbrella term that can describe a collection of brain diseases and their symptoms, such as Alzheimer, vascular dementia, Lewy body, and other dementias. And now we will discuss the symptoms. Now we have some famous symptoms for dementia. The first one, which is memory impairment. It can be a little hard for the patient to remember some recent events or some important information. Cognitive decline. And then we have the difficulty in performing daily activities, like something that they used to do every day. They suddenly forget how to do it. We have some language difficulties. They can struggle in finding the right words, or they can even forget words in their own language. We have the disorientation, that they can get lost in places that they used to go to every day. And now we will get to the causes and risk factors. The first one, which is the neurological damage, which is disorders like Alzheimer's and Parkinson's can contribute to the damage. The second one, which is the cardiovascular conditions, which is the hypertension or high blood pressure and diabetes. And for the third one, which is the age related, for this one, the risk increases with aging and especially after reaching 65. And also it can be related to human genetics. And in that case, family history can evaluate the risk factors. And now we will discuss the functional foods that can be consumed to help with dementia. The first one that we have is the omega-3 fatty acids, which comes from flax seeds, walnuts, and fish oils, shea seeds. And the second one is turmeric or curcumin, which which is turmeric spice or curcumin supplements can be good sources. The third one, which is the green tea that can come from green tea leaves or matcha powder. They can also consume seeds, nuts, and vegetable oils as a good source of vitamin E. We also have citrus fruits, bell pepper, and broccoli, which are can be considered as a good source for vitamin C. We have the last one, which is probiotics, which is present in fermented foods such as yogurt and kimchi. And now we will be discussing the omega-3 interaction with the disease. And it can be summarized in that pathway, which starts with the consumption, and after that, the digestion, the absorption to the bloodstream, and then to the liver processing, crossing blood-brain barrier, integration into brain cells, uh, cognitive benefits, and the last one, which is dementia prevention. And the last thing that will be mentioned in today's topic is the doses. So the first dose of consumption here, which is for the omega-3. For example, we can consume up to from 1 to 2 tablespoons daily from the flax seeds. For the turmeric, it's from 500 to 2000 milligram per day from the curcumin extract. Green tea for about from 2 to 3 cups per day. Vitamin E from 15 to 30 milligram per day. Vitamin C, it's a little higher, which is from 75 to 90 milligram per day. And for the probiotic, it's from 1 to 2 serving per day of probiotic rich foods. And for the probiotic supplements, we have from 1 to 10 billion CFUs daily.